Welcome back to the channel. So last class we have started the histopathology of lichen planus and we have almost completed it. Today we'll be dealing about the treatment plan and prognosis and the little left part of the histopathology. Okay, let's continue. So we have seen in previous class that lichen planus does not produce a single definitive histologic picture, and depending on the stage the changes may be non-specific. This plastic disease can also be associated with banded lymphocytic infiltrates, which should not be constructed as representing lichen planus. And chronic ulcerative stomatitis is a condition that mimics lichen planus. It may be present as a desquamatic gingivitis or as ulcer or erosions with peripheral whitish streaks. तो chronic ulcerative stomatitis भी कुछ ऐसा lichen planus को mimic करता है, but it should not be confused, and the immunohistochemistry of chronic ulcerative stomatitis and lichen planus is different. Now, direct immunofluorescence shows positivity only for fibrin in lichen planus. Okay, that's all about the histopath part. Now we'll coming to the treatment part. The reticular and plaque forms usually do not require treatment other than reassurance and follow-up. The milder cases of erosive lichen planus and some symptomatic cases of other forms, that is plaque and reticular forms, often can be managed with topical corticosteroids. Usually 0.05% fluocinonide gel 4 times daily or combined with the antifungal agent griseofulvin. So this griseofulvin is very important drug in the treatment of lichen planus. So griseofulvin 250 mg of the microionized form twice daily. तो एक टॉपिकल कॉर्टिकोस्टेरॉइड्स यूज़ करेंगे हम लोग और एक एंटी फंगल एजेंट. कब? जब माइल्ड केसेस ऑफ इरोसिव लाइकेन प्लानस होगा तब, या फिर तब जबकि अदर सिम्टोमेटिक केसेस होगा इनका रेटिकुलर और प्लैक फॉर्म का. ओके, टॉपिकल 0.1% tacrolimus cream also may be used. Most erosive lichen planus require systemic corticosteroid regimen 1 or 2 and less commonly 3A और 3B. तो जो मोस्ट इरोसिव लाइकेन प्लेनस होंगे, मतलब माइल्ड नहीं सीवियर केसेस, उनके लिए हमको सिस्टमिक कॉर्टिकोस्टेरॉइड्स रेजिमेन लगेंगे. ओके, ओरल griseofulvin topical 0.05% fluocinonide or 0.1% protopic can be added to either regimen to reduce the prednisolone requirement or help maintain a remission. तो systemic corticosteroids regimen के साथ हम ये सब भी ऐड करेंगे. In refractory cases, systemic tacrolimus or rituximab can be effective. Topical retinoids, a vitamin A analog, is used for reticular lichen planus. Dapsone has been effective for mild cases of lichen planus involving skin, and the doses are 50 mg per day for several weeks. Okay, now coming to the prognosis, इसमें mainly antifungal और topical or systemic corticosteroids you have to remember in short. Okay, now coming to prognosis, erosive lichen planus responds well to systemic corticosteroids. Complete treatment at low dose of prednisone may be extended up to 3 years. A milder residual clinical disease often persists, and consequently a drug-free total remission is less common than a maintenance control remission. तो mainly जो इसका प्रोग्नोसिस है, इट इज़ अ मेंटेनेंस कंट्रोल रेमिशन, मतलब प्रिवेंशन, नॉट द क्योर बट द प्रिवेंशन थिंग. ओके, नाउ Often, the disease can be suppressed with prednisone to a point at which topical flucosinonide and/or crisofulvin can maintain the remission without continued prednisone, or with only a low every other by prednisone schedule. Okay, that's all about lichen planus. We'll be starting new topic in the next class. Till then, like, share, subscribe, and comment. Bye.